Hey, good morning, folks. Today is March 7th, 2025. This is Coffee with Community Services, Alta California Regional Center's weekly service provider meeting. My name is John Decker, the Director of Community Services. Thank you very much for joining us today. We've got 72 folks on so far. As usual, I'm going to go over staff introductions and then our agenda. We'll get started. So for today, I see from our Community Services Department, we've got Odelia on and Alicia and Virginia. I also see Christine and Michael and Rhonda on as well. And Kylie and our manager Helen is on from Community Services. Good morning. And I see Marty on here and our lead Community Services Specialist Jason. Also, we have Christy Awasa on. Good morning, Christy. Let's see, who else do I see on here? I see Jolana, good morning, and let's see, Sammy Lynn and Tom Caspar are on, good morning, and Toby Golden as well from Client Services, good morning. Additionally, from Community Services, we have Jessica and Shauna and Jaslyn and Carly and my assistant Zach and Dan. And our manager Michelle is on, good morning, and I see Janice and Hubert and Christy and our manager Jordan as well, and Rihanna there too. So good morning to the staff. And for our agenda today, we have our sign of the week and Deaf Culture 101. And again, great job last week presenting on the communication cards. We have a discussion about the rate study and transitional rates and the quality incentive program. We have our HCBS team are going to be presenting today, so you're going to hear from our HCBS team. We have a spotlight from Gopal ILS, and so you will hear from Anita as well. We have some updates about ACRC and DDS's upcoming calendar and events, and also a notice that we are going to be canceling our March 21st meeting. So we are going to be canceling our March 21st meeting. So with that, if there's any other agenda items that you'd like us to cover today in the meeting, other things that you'd like to be updated about, please don't hesitate to put them in the chat, or there will certainly be opportunities to unmute yourself and or raise your hand. So, and thank you. And I see we have one of our interns on. Thank you very much. Yes. And for the other Alta staff, this is an opportunity for you to listen to updates that are given to our service provider community. So thank you for joining us. All right. Michael, I'm going to throw it to you and spotlight you, sir.
Good morning, everyone. Good morning. Happy Friday. Today's sign of the week, we have two today. I have break time / take a break. And then we have the sign for rest / relax. I encourage you guys, I know we have such busy lives. I know I'm teaching you these signs, but I want you to actually take a break and relax from time to time. So for these signs, we do our hand shapes like this. You're going to bring your non-dominant hand. Sorry, you're going to lay your hand flat, and then your non-dominant hand is going to open up your fingers this way so that you can place your dominant hand in between those fingers. So once you place your fingers in between your other hand's fingers, you leave them there. You hold it there for a moment in order to make that sign. For relax / rest, you cross your arms over your chest like this. That's rest or relax. One more time, we have break and rest. So remember to take a break and some rest, especially when you need it. And for Deaf Culture 101 today, if you missed the presentation from last week on Friday, I really strongly encourage you to check it out on YouTube. That is language deprivation part 1, and today we'll be doing language deprivation part 2. So again, we'll be talking about language deprivation. and how that affects deaf and hard of hearing children. So how do parents make sure that child can get full access to language, and what steps can they take to know if it's even working? Whether it be whatever intervention they're using, speech therapy, cochlear implants, hearing aids, we're going to discuss how parents can learn how effective these approaches are. So one important uh, piece of legislation is LEAD K, that is helping children get the right to acquire language skills. It was uh, passed in 2015. California passed Senate Bill 210, the Language Equity and Acquisition for Deaf Children, or sorry, deaf kids, that's where you get the K. This law helps make sure that deaf and hard of hearing kids are ready for kindergarten by the age of 5. It promotes both American Sign Language as well as English. It has a bilingual approach for language development from birth. So the LEAD K process, you may be wondering how it works. So when parents are in the hospital and they give birth to their new baby, that baby will undergo a hearing test. The hearing screening will show the results of maybe potential hearing loss. And in that case, that will generate a referral to LEAD K, a family service. LEAD K will provide the family with support and follow that child's journey as they develop language, and they will support that journey along the way. In terms of language milestones, this has been established, and parents and teachers should be tracking their child's language milestones and their language development during the IFSP and IEP meetings for the schools. These language milestones, the parents have a profile tool that can help. There's a profile tool available to help parents ensure that they're tracking these milestones and encouraging their kids to reach those milestones at the appropriate age. Parents can get early intervention and LEAD K services together to ensure that the language milestones are being met before the child enters kindergarten. I'm going to share my screen with you real quick so I can show you what those milestones and that checklist might look like. So you can see this web page. So this shows your deaf child's early language acquisition journey, and this provides the information needed to show that represents the appropriate language developing milestones for each age range. This will also list and items that you can check off if the parents are noticing these. Maybe some parents don't want to learn ASL, which is fine. Support can be offered through the process in helping the child develop language by being able, or they may be able to identify that they're missing some milestones, which then might change the parent's mindset in order to then encourage learning American Sign Language. That is a very helpful tool for parents to follow as they're assessing and observing their child's language development. So the law LEAD K that was passed in the US, it has been passed in 20 states so far. This LEAD K law is to ensure that deaf and hard of hearing children have access to early language development. Some states, for example, that have passed this law are California, Hawaii, Kansas, Oregon, South Dakota, Georgia, Louisiana, Michigan, Missouri, and Iowa. So
So we want to make sure that children are ready for school and that they have that language foundation. So now when you see lead K, so obviously that word means lead or guide, and then K means kids. So it's a nice brand name. It means we're ready to lead kids to kindergarten. So we'll have a part 3 talking about what lead K looks like and what the responsibility is. And then lastly, I wanted to finish with Deaf Culture 101. Now, there's an event next week. It's on March 15th. It's called Love and Literary Reading, or Love and Literary. So it's for deaf and hard. Oh, sorry, just one second. Okay, so it's for deaf and hard of hearing children to have some storytelling with signing some books. We'll have some arts and crafts, food, and then different books available. We'll have a booth there. I'll be there. Hopefully you can join us. You can learn about the organization, what Love and Literary is. And this is a part of Lead K. So they're hosting that event. Thank you so much. And yeah, I think there's 10 happening at the same time in California. It'll be near Natomas in Sacramento.
All right, thank you very much, Michael. And we've dropped that information in the chat. And shout out to Janae for jumping in as our interpreter real quickly there. All right. I want to actually, Anita, I want to use your time well, and I know that we've got you here on camera. So maybe can I throw it over to you next for Gopal, Curriculum Independent Living? And we need you to unmute yourself. We need you to unmute yourself as well.
Good morning. Can everyone hear me?
We can hear you perfectly.
Okay. Looks like the volume had went away there. Hi, my name is Anita Alexander, and I'm with Gopal Curriculum Independent Living LLC. And I wanted to just tell you a little bit about Gopal Curriculum Independent Living. We service the Sacramento area. We service all clients from autistic to intellectual disabilities to those with the forensic population that have been formerly incarcerated and are needing independent living skills and adjusting in the community. Currently, we are working with someone that I went to see at the jail, Sacramento County Jail last night, to work with him and give him services. He has an intellectual disability, and I'm doing an assessment to work with him and provide him with all of our services that he needs, such as getting assistance with medication, doctor's appointments, shopping in natural environments, meal planning, self-advocacy training, and other services that he will need to get help with his SSI, etc. So helping him to reintegrate in the community from being incarcerated at the Sacramento County Jail. So like I said, we take a variety of clients, but I do specialize in a forensic background and a forensic population of working with clients. So we are taking referrals, and it seems like since February 4th, the referrals have increased in the forensic area. So I just wanted to tell you a little bit about us. The brochure is in the chat. If you have any questions, you can contact me at 916 909 3963. And again, that's 916 909 3963. And that's Gopal Curriculum Living, Independent Living, LLC, helping the clients to live their best life. Thank you.
Thank you. I just want to, illustrate the importance of attending our vendor fairs when we have them. It was an opportunity for me to meet Anita, and some of you know that my background was as the forensics manager at the regional center, overseeing that for many years. And so when I met with Anita and heard about her interest really in supporting individuals that have forensic involvement, and also not having a lot of referrals, it was great to be able to connect her with Jordan's staff and be able to do a spotlight here. I know we've got some client services managers that have joined us as well, who now may be hearing about this new service if they were not able to attend the ILS vendor fair. So I appreciate it, Anita. I guess one question I just had for you real quickly, if that's okay, is just
Yes, go ahead.
you've got this passion for this. You have this interest in this for forensics. Why is that important to you for your business?
It's important because that's an area that we have to address. And sometimes people can be scared of the population and they don't really want to take those type of referrals. So it's important for me to be there to be able to accept these types of referrals, since I've dealt with the population, having worked at San Quentin Prison, having worked in the field of many cities such as Oakland and all around the Bay Area and very dangerous communities, and having worked with this population there and with community care licensing. So I've worked with all types of clients, from every range of developmental disabilities at community care licensing, and then having taught at the college and having to work with those that are developmentally disabled and having to give them accommodations. So it's very important, a passion for me to address that population.
Awesome. Thank you very much. I will say, having supervised the forensic specialist supervising Christy Owasa, I remember those words coming out of her mouth about the apprehension that service providers have in working with the forensic individuals. And so, for many years, some of these staff that have been trying to support folks through their, whether it's a diversion plan or whether or not, they have previous, court involvement or have come out of jail, I think it's just encouraging to know that there's more and more services that are becoming available, for individuals. So thanks so much, Anita, for talking about your service, and hopefully this sparks some things in folks that might find an individual that would be appropriate for your services to refer.
Thank you for having me on Spotlight. Have a great day.
Awesome. Again, the method, refresh my recollection, Michelle Duchesne, for those that are interested in being spotlighted.
They just have to email Jason Scantleberry and he can put his email in the chat. And then we'll find an opening.
Awesome. Thank you very much. I did, just as it relates to spotlights, I had a couple weeks ago mentioned that Shift Care is someone that we were going to bring back on just for a little bit more of a Q&A for a lot of you, because you had questions and we didn't give them very much time. So just letting you know that we're working that out with them to get them back on to talk about the Shift Care platform and give you guys a little bit more opportunities to ask them questions about that. We certainly do have a number of service providers that reach out to us with an interest in having their services discussed in this type of setting. People always ask, well, where are these meetings at all the other regional centers? And we do have some regional centers that'll do kind of like a quarterly meeting like this. People certainly have vendor meetings, but not like every single week, which we've done now for 4 years, folks. So I think we figured out we've had about 180 or so meetings or something like that. So appreciate everyone's continued participation, as we have about 98 folks on today. I would like to transition to our next favorite topic, which is the rate reform and the implementation of the quality incentive program. I'm going to share my screen with folks so that they know what I'm looking at here. And there's not huge changes that have gone on really in the last week. Last week was you got cutting edge news because I read the information directly that came from, the executive staff at DDS that covered all of the rate study implementation updates. But I do want to go through this information real quickly. Again, we have new people that join this meeting and make sure that folks are aware of any updated information that we have. So I had an opportunity to meet with DDS. We've met twice about rate reform since our last coffee with community services. Couple of the things that I think you're aware of, but I want to highlight is that the department is still looking at different rate models for the possibility of making revisions to those rate models. The rate models that the department is still looking at possible revisions on. And again, you can find our rate models for the rate study here. You just let me navigate there. They're looking at the early start rates currently. They're looking at 880 additional transportation component. So the additional transportation, let me say that very well, additional transportation component tied to typically day programs or care homes. And then they're looking at the 875 transportation rate overall as well. Those are kind of the big ongoing discussions. They did convene a work group kind of statewide of service providers and regional centers to start talking about the 880s. But a lot of this information is really dependent on the hold harmless data that is provided to the Department of Developmental Services. So again, when we're talking about rates that people are going to be receiving, if you have a hold harmless rate, which means a rate that is something that's higher than the amount here, it's something that those rates are only going to go through until June of 2026. And so right now, until the department is aware of how many people fall into the hold harmless, I appreciate the way they described it though, which is basically if you fall into the hold harmless, there's a problem. The rate study was intended to standardize rates and to try to get them covering the costs that service providers have. And so that's why I will say the exemption requests are going to be heading over to the department so that they can take a look at those rates that don't seem to align with these new models, because again, the hold harmless is not supposed to be there's not supposed to be a lot of them that have hold harmless, and so those are the ones where they feel like they really need to look at it. But again, until they have the data, it makes it really challenging to see the disparity between what service providers say that their rates are, what their costs are, and what the rate study has said the rates should be. Again, the rate models are all available on DDS's website. This is the page that has the one specific for Alta California Regional Center. Additionally, you can find the detailed information, and there's been no updates to this information. This is, what was I looking at last? I was looking at day services, community-based. And so this shows the breakdown of how they develop the specific rates within the rate study. So for those of you that are at some point receiving an accurate acknowledgement form from the regional center, you'll be able to review the rate that is being given to you and compare that to the information that is here. And what I think all of you really need to look at is these are the allowable costs, in essence, that they're looking at funding, and the ways in which you may need to align your businesses with the way the rate study indicates they're going to be giving you revenue in the future. So whether that means how you have your supervisors in place, how you have consultants possibly in other ones. And these are things that are going to require some program design addendums as well, which we'll be kind of working on with you. But this is that source documentation that gives you the insight into how Burns and Associates came up with the specific rates that we are putting into those acknowledgement letters that we're sending out to you. as to acknowledgement letters and rate reform, one of the challenges that we've expressed to you all is that in order to implement rate reform, we have to have the updated and accurate quality incentive program information. And the Department of Developmental Services is keying the quality incentive off of your participation in the service provider directory. So this is just a reminder. I will say that this information, it says last update was March 4th. What I'm encouraged about is that the QIP eligible list did not change, which means the same information we shared with you a week ago, which is that all of the individuals on this spreadsheet here, and I'll go up to the top of it. And this is what Robin and Iqbal are all working on right now, is making sure that we get all of our rates updated and payments retroed back to January 1 as appropriate for service providers under this area. So Alta California Regional Center, you can see our list of folks. We have a huge, significant number that they've put through the system here. So just, you can look up your lists here. Let's see. The needs survey list, and we'll take a look at that. So these are the ones that are not going to be getting the QIP. So there's only two lists now, really. There's the ones that, let's see, have not been contacted at all or have not been in contact at all. And so there is the list of our service providers in that case. And it looks like, yeah, we're at 68 service providers. So again, I think that's really significant that we have so many service providers that have been successful in being able to complete the service provider directory, which means, again, they are eligible to get the full payment amount effective January 1. And again, we are responsible for doing retros. For these individuals that do these surveys, they are going to be, once they're done, loading them into this list right here, the QIP eligible list, that we can check it against. Additionally, our understanding is as new providers bridge over in the, I think it's UFIS system, to the department, that they will be receiving an invitation to complete the service provider directory information within 45 days. And these are just some of the new vendors that we've done as a regional center recently. So they've got that list on there, and eventually we'll see that list move over too. So they now have updated a lot of this quality incentive program information. And then that now gives us an opportunity to be able to do our acknowledgement letters. So to clarify about the acknowledgement letters, oh, Michelle Duchesne, did you say we already sent out 850 letters or so, I believe?
Yes, about which our team is retracting at this time.
Yeah, so if you see anything disappear out of your sign now queue, it's because we're going to be deleting any of the inaccurate letters that are waiting for a digital signature so that we can re-upload them with accurate information. As we went over last week, the Department of Developmental Services has indicated to us that, I'll just open this up as an example just real quickly about acknowledgement forms. The Department of Developmental Services indicated to us last week that it is the charge of the regional centers to create a accurate acknowledgement form that includes the quality incentive program information. My feedback to the department was that then we're going to do our best to get things in by March 31st, which is the deadline that DDS has continued to affirm. However, as of 3 days ago, we did not have your service provider individual rates yet. Those just got downloaded to us with the updated QIP information so that we can then, when we send out your rates to you, actually have discussions and show you the breakdown of the calculations for your individual rates. So right now our process is, and that I told Robin LeMay that from our accounting department that I'd give you all an update, that we're really working to make sure that we have accurate rate reform service acknowledgement forms before they come back out to you all again. We're really looking closely across a lot of the different service codes, making sure that we've got all of your subcodes, which is like your ratios for your programs appropriate and accurate in there. In some cases, you know, you may have a program that's going from one service to 3 different services. And so we're trying to, get that information very clear on here. But more than anything, just making sure that you have the updated, correct information from DDS about what your rate is, what your quality incentive amount is. So with the charge to do them all accurately, and with us having to really look at things, we've already sent out 800 letters to folks. So I feel like we tried. We did our best to send out accurate information. So that being said, we're going to do our best to get letters out before the end of this month. But right now, we're still confirming information before we can send it to all of the providers. There's some service codes that are a little bit easier to update now that we have all the QIP stuff, but there's still certainly some discussions that need to be happening. I think for all of our exemption vendors, we've addressed all of those. We already know it's going to be on those acknowledgement forms. We already know it's already going to be on the exemption requests that are being uploaded to DDS. Michelle, anything I missed about that at all?
No, we've submitted all the exemption requests to the department
Oh, good. Those are already in.
and we've uploaded those. Mhm.
So they created a portal for us. This doesn't apply to about like 6 vendors, but they created a portal. But all 6 of you, I think, are in this call right now. But they created a portal for us, so we were able to upload your exemption request, and then we also included your program design, I think, at DDS's request as well. Did they ask for anything else? I think it was just those 2 things, right?
Correct.
Okay. And so we will wait. I know that they said that they've already received a really significant number of exemption requests. They do not believe that all of those requests are going to be like reviewed before March 31st, the ones that had previously been put in. But the sense of urgency is that, the transitional rates are already in effect. So you all should have some transitional rates right now, and the rest are held harmless at this time period. So I feel like the department's got a little bit of time to figure out how we can move from whatever's put into the exemption request to whatever is a more appropriate service code within rate reform. And this primarily, I'm going to share my screen real quickly. This primarily applies to service providers under this category here, which is the service code crosswalks. So we've got some providers that are having some challenging times crosswalking. And so we are looking at doing an exemption request. I just realized that I'm not sharing my screen as I'm looking up there at it with folks. But this is the crosswalk. And again, it's going from one service code to another. There's a lot of moving parts, and there's almost 1,400 different vendors that we are working on, or vendorizations that we're working on with this. So again, increasingly the all completed by March 31st timeline seems like something that may be a challenge for regional centers. However, we are going to continue to be putting all of our efforts forward to get the information to you all, because we recognize that in some cases these might be rate increases for some providers, and so we want to ensure that we have those discussions. There's some service providers that have an opportunity because of rate reform, if this makes sense. So we have some service providers that are under service code 102 and under other service codes that were not included in the rate study that have an opportunity for us to possibly increase their revenue, be above even like their current rate right now, by aligning them to some new service code that's within the service provider, within the rate study. I think Jordan, we're probably looking at like April or May to really work on some of those, right? Because we want to ensure that all of our existing vendors that are currently have a need to get transitioned and crosswalked over are handled first. And then we're going to start looking at other vendors that may benefit from a transition to a new service code, but we don't feel like we have as much sense of urgency because we have not already done like new transitional rates for those providers like we've done with some of the rest of you, where we really do kind of want to get you on board with the new directive because we've been paying you since January 1, with the new rates that have been available. So again, as we told, like Jordan asked about like, oh, it's getting into like, April or May or something like that. And we don't have these letters and everything else, but the most important thing is that we have the transitional rates in place, and then you guys are getting paid. That's the important thing, is that, for those of you, you still may have your same old service code. There is a likelihood that you may have your transitional rates, some of you under some service codes, through June, which means, again, you have the steady rate increases that are appropriate for you, but you may not move over to a new service code. You may not move over to the new subcode until we can ensure that we've got like an alignment and understanding what you're going to be, but also that we are prepared for our service coordinators to write appropriate authorizations under whatever you're going to be in the future, if that makes sense. So again, I've been mentioning this the last couple weeks, is that we have the process of trying to get the vendors aligned under whatever their new service codes are going to be and their new expectations. And then we have to look at the guidance that we give our staff in changing authorizations, for example, to doing it a different way. And so we recognize that that's a process that's going to be going on over the next couple months. And it's a challenge because there's still some unsettled things. So, we recognize that we are going to have to be, I think, mindful of how we look at some of our quality assurance things with our service providers as we go through this transition. And I know we're going to throw this to our HCBS folks after this to talk about HCBS, but I just think, again, for service providers, this is going to be a little bit of a challenge, and we want to ensure that our service coordinators on the regional center end are aware of any changes that are going on with the vendors or with the way the services are authorized before we move you away from your current billing methodologies that you have right now. I know it's kind of complex, but that's what this meeting is for, is to get kind of a high level understanding of how we're doing these things, and also to give us feedback about what you guys are seeing and what works. So that is our plan right now. We're making, again, every effort to get the acknowledgement forms out to you accurately as quickly as possible. We are then working on our regional center procedures for service initiation and our things like instructions to service coordinators for planning team meetings to change authorizations over to what your new type of service or billing methodology may be. So those are the processes, and we're going to be probably into July by the time we flip the switch over for like all of the authorizations. There might be some authorizations that we can switch over earlier because it's relatively easy to do that. Like, we've already been talking with some of our supported living service providers about moving them over to the 3945 rate or something like that. So in some cases we can do this in smaller bunches, but just looking at overall completion of this, it does push us back about 6 months later than what DDS had originally said, which is that regional centers should start having like planning team meeting discussions with families about the new ways that vendors are changing in calendar year 2025. But again, our service coordinators are not prepared to have those discussions quite yet. So I think everyone is as updated as they possibly can be about the rate study stuff. Let me just see, do you guys have any questions? Once we sign, let me go to Joe's question. Once we sign one of our programs, we'll have a ratio change. Will this require us to hire? How much time do we have to meet the ratio change? So is it going from a variable ratio program to a 1-to-1 or 1-to-2?
1-to-3.
1-to-3. So I would say that I don't know that you have time to change. I think that you can bill us for the ratios that you can provide to clients, but I don't know that you have time to get yourself into ratio in that particular case. I feel like the department is going to come back and they're going to want source documentation showing that you had actual staff present to meet the ratios that we were funding, probably from day one.
Okay.
The clinical and behavioral oversight is a little bit of a different story because they specifically wrote that into the directive, saying that service providers have time to onboard for behavioral and medical programs, those ones. But I think for direct staff hours, it's so black and white. I feel like, yeah. Other questions that folks have about rate reform? We're going to have a good discussion, I'm sure, about it next week at our Provider Advisory Committee meeting. Can I throw it to the HCBS staff, please?
Yep, we're ready.
Is anyone sharing their screen?
I will.
You may.
Perfect. Okay. It's going. It's trying. Okay. Hopefully. Okay, are we up and running?
It looks very good.
Okay, perfect. So my name's Alicia. I'm one of the HCBS specialists here at Alta, and we're going to talk a little bit about our ongoing monitoring, which just started up again in February. So just skip through this. So I'll start off with a couple of quick definitions for those who are unfamiliar with HCBS. So CMS is our Centers for Medicaid and Medicaid Services. That's our federal agency that oversees our distribution of funds to the Medicaid waiver program. So if a client's on waiver and we submit to them, we get 50% back of that funding from the federal government to help fund our services. HCBS are services provided in a person's home or in a community rather than institutions or isolated settings. And the final rule is the change to that federal regulation regarding those Medicaid funds. So as in terms of regulations, these HCBS regulations that we go assess for are federal laws, and they apply to many sectors, not just Alta or regional centers in general. There's rules that apply to the Department of Public Health settings, Affordable Care Act settings, and other settings in the state of California. So we are micro-focused on a set of those federal regulations. The rules applies to our settings that are congregate and disability specific. So if you're looking at like a camp that services individuals who have disabilities and that don't in the same camp, those aren't considered disability specific services, so we don't assess those ones right now. And if you're looking at like ILS services that are one-on-one services, those are not congregate services, so we are not assessing those right now. Typically what we are assessing are care homes, day programs, and some employment programs. So the mandate is that in order for us to continue receiving our federal funds through the waiver, all settings have to be compliant with these HCBS regulations. And these HCBS regulations are meant to expand the rights of individuals in need of services nationwide because California is leaps and bounds ahead of most states. But we're trying to catch everybody up in terms of human rights. So this chart real quick just kind of shows how we've gone in federal regulation from one kind of setting to another. So we had been sort of in an exclusionary model before developmental centers. So individuals with disabilities were kept at home. They were not part of the community. They were excluded from community life. And then we decided to open developmental centers and institutions nationwide. And we told parents that like your child will be congregated with other people. They'll have peers to talk to. It was seen as a good thing. And that's why we opened so many, because individuals would get the support they needed and be able to not be excluded from community. They'd have their own community. And as we know, since we're shutting down developmental centers nationwide, that this is not really a great model. It doesn't allow for much care or support or supervision. And we in California started moving to this integration model in the 80s and 90s, where we opened a ton of care homes. And these care homes were meant to integrate individuals in the community. We heard the word integration a lot. But if you are an individual living in a care home and you are surrounded by your peers, and the only people who aren't disabled are your staff, and then you get on a bus and the only person who's not an individual with a disability is sort of in charge of you, then you go to your day program, where again, lots of them are sheltered workshops. The only interaction those individuals have with people without disabilities are staff again. You send them back home on their bus, they go back home to their care home. We've sort of created these tiny mini institutions within our community. So where the goal was integration, what we did was we have the institutions in the community instead of out of. So these new HCBS regulations are meant to be inclusionary of all people in the community doing what they want to do, making their own choices about their lives. And we can all understand why that's good for an individual, why an individual would want to make those choices. But I would also say that it's good for parents of individuals with disabilities. As a children's case manager, there are lots of times where you'd get a 3-year-old who was diagnosed with a disability, and the parent, the dreams for their future, for their child's future, they sort of didn't know what that was. If it was in limbo, it was almost a grieving process. So the fact that individuals are in the community, they're part of everyday life, makes that transition easier for everybody. Okay, so the Regional Center is reviewing a total of 10 HCBS regulations. The first apply to all congregate disability specific settings, and the second 5 apply to our residential settings only. And there are exemptions, and Kylie will talk about that in a few minutes, but exemptions can be made to the second 5 on an individual basis. So real quickly to go through the regulations, the first is that we make sure our settings are integrated in the community and they support full access to the community. We want individuals to have opportunities to seek employment, to work in competitive integrated settings, to engage in community life, control their own personal resources, and receive services in the community to the same degree of access as individuals not receiving regional center services. We want to make sure that individuals are selecting their services. They should have options of programs, including non-disability specific options. And in care homes, they should have an option for a private room. All of this should be written into the IPP. The third rule is that we are ensuring an individual's rights of privacy, dignity, respect, and freedom from coercion and restraint, which is something that we've had in California for a long time on a state level in those Title 17s, Title 22s, but no rule nationwide about that. And we're ensuring that our setting and service optimizes but doesn't regiment initiative, autonomy, and independence in making life choices. So people can decide what they do to their day to day life, what physical environment they're in, who they interact with. These are basic human rights. And then we make sure that the setting and service facilitates individual choice regarding services and supports and who provides them. So if an individual is very uncomfortable, they need support in the bathroom, and they're very uncomfortable with someone of the opposite sex helping them, they can say that they are not comfortable with that. And programs and all of you wonderful support providers can help them with that. These second 5 are the residential only. So we make sure that there's a lease in place, giving individuals the same eviction processes and appeals comparable to those under the jurisdiction's landlord tenant law. So individuals, while Alta pays for the care, individuals out of their own Social Security money pay for the room and board. So they are tenants as well as individuals receiving care in a home. Everyone should have privacy in their sleeping or living unit. So bedrooms should have entrance doors lockable only by the individual. Staff can have keys as needed, but individuals should have that right to privacy, especially from housemates or anyone else they feel uncomfortable around, or just to have private time. Individuals sharing rooms should have a choice of roommates in that setting. And individuals should have the freedom to furnish and decorate their sleeping or units within the lease or other agreement, just like you or I could decorate a house that we own, or in a dorm, you can put up your own posters and stuff. Individuals should have the freedom and support to control their own schedules and activities and have access to food at any time. Now, I'm not saying that staff need to wake up in the middle of the night and go cook someone bacon and eggs, but everyone should be able to grab a snack in the middle of the night if you're hungry. Individuals should have visitors at any time, and we should make sure that the setting is physically accessible to the individual. So those are our 10 rules. And I do want to throw in that we are looking for grants soon. The letter has not been sent out from DDS, but there's now saying any day rather than any time. So these 10 regulations are what we're looking to apply those grants to. So if you are looking to apply for a grant, make sure it falls within those HCBS regulations. Okay, I'm going to throw it over to Kylie to talk about the what ifs. What if you have an individual who can't meet some of those needs?
Thank you, Alicia. Yeah, so with all of those regulations in place, we understand that there's some gray area. So the federal rules do allow for some flexibility within the residential requirements, which is rules 6 through 10. This is called a modification. Modification processes are used when individual clients have needs that do not meet the final rule. All homes must have program designs that comply with all of the requirements in the final rule, and changes to any HCBS requirements can only be done on an individualized basis utilizing modification processes, and these processes must be supported by a specific assessed need agreed to by the client and outlined clearly in the IPP. So these are the requirements for a modification. When proposing a modification of the requirements, the following must be included in the person-centered plan. So identifying the individualized assessed need, documentation of positive interventions, documentation of less intrusive methods that have been tried but did not work, including a clear description of the condition that's directly proportionate to the specific assessed need, regular collection and review of data to measure the ongoing effectiveness, including established time limits for periodic review, including informed consent of the individual, and including assurance that interventions and supports will cause no harm. Now, just being conscious of time, typically I would walk through an example of this, but if you have a situation where you think a modification is necessary, please reach out to the HCBS team, because typically we can work with you to kind of help avoid putting a modification in, and a modification is used kind of as the last the last thing that we go for. So if you have a situation where you think a modification, such as locks being placed on pantries or something along those lines, if you think something like that might be necessary, reach out to us and we can kind of assist in maybe avoiding that or seeing what we can do to put that in place.
Awesome. And I also just want to mention that these regulations, specifically these modification requirements, are written into the law. It's not something that is regional center policy. This is specifically written into the federal law. Okay, Marty's going to talk a little bit about our assessment process.
All right, thanks, Alicia. Thanks, Kylie. So here's an overview of what to expect for your upcoming HCBS site review. The HCBS team is visiting all programs that are congregate and disability specific again this calendar year. As Alicia mentioned earlier, we started last month in February. So an email with a scheduling letter attached will be sent out on the 15th, the month prior your review. For example, if your visit is in March, then you would have received an email by February 15th. You will have an opportunity to reach out to your assigned HCBS specialist and schedule a date for the visit. If you do not respond to the scheduling email timely, your review will be an unannounced visit for that month. Reviews take less than an hour and need to be completed when individuals are at home or program. And administrative staff do not need to be available for these reviews. So our HCBS team will review a provider's program design before we go out to ensure that HCBS requirements are documented appropriately for care homes. And we also review each resident's IPP to see if there are any modifications listed, as Kylie mentioned earlier. If so, we confirm that they're written correctly and also include all the necessary information. And we will also work with the SC in that case. After we do an internal review of this documentation, our team will complete the scheduled site review at your home or program. So for homes, we will primarily be reviewing client bedroom doors for keyed locks, preferably with auto release, and locks on all bathroom doors for privacy, as well as resident bedrooms decorated as the residents desire, access to food, and accessibility to the homes, or excuse me, to the rooms in the home. For programs, we will review restrooms for privacy. But for both homes and programs, we will complete client interviews on site. 10% of clients in programs or homes will be interviewed. For example, if there are 20 people at a program, we will interview 2 individuals. And we will also interview staff if clients are conserved or not able or do not want to talk with us. Upon completion of this site review, your home or program will receive a compliance letter or a remediation, which indicates a requirement that may not have been met. And in that case, our team will work with you and we will support any providers that should they receive a remediation to become HCBS compliant. So if anyone has any further questions ongoing, you can contact our HCBS email inbox at altaregional.org. Again, our home and community-based service specialists are Alicia Van Eck, Kylie Draper, myself, Marty Eason, and Chris Takeda Miller.
Excellent. I have just a comment. People just went through all of this. And so I guess the question is, well, why are we continuing to do this ongoing? I just went through all of this. And like HCBS compliance is not like a destination. It's like a journey, because you're going to always constantly have new things going on, new individuals that are going to be part of your programs, new people that are admitted, new changes in needs of individuals that need to be addressed within what got presented a little bit earlier. So through that lens of compliance. So appreciate all the work that is going to be going into these moving forward. And certainly I think we might talk about having you all come to the Provider Advisory Committee meeting and giving that group a bit of an update about that as well. With that, I do want to mention that we do have an upcoming Provider Advisory Committee meeting. And I'm going to share my screen real quickly. For Provider Advisory Committee, we have, it is going to be next week. Let me share my screen real quickly. Let's get into some of our events here real quick before we close. So Provider Advisory Committee meeting is coming up. The meeting is going to be scheduled. There we go. Was our website landing page for them. So that meeting is coming up next Thursday. It's going to be at our new office. They just sent out the location of it, which is going to be on the first floor of our building, which is I think near our gym. So we'll be having folks in the lobby to help show folks the location of where our Provider Advisory Committee meeting is going to be next week. But hopefully you can come in person. That would be cool. Check out our new office. Many of our staff got tours this week. Michael got to pick out his cubicle. I get to be as loud as I want to in my office because he's right outside my office. So it's a good trade-off for us. All right. So I hope everyone has a great weekend. We'll look forward to talking to folks next week. Look at Toby's in the new office. You can see how fancy it looks right there. All right. You guys have a great weekend. We'll talk to folks next week. Take care. Bye-bye.